This is Dr. Jack Kleid. I'm going to talk to you today about belly fat. If you have excessive belly fat out there, it's time to do something about it. When we talk about belly fat in medical parlance, we call it abdominal obesity or abdominal adiposity. In males, if your waist circumference is greater than 40 inches, and if in females your waist circumference is greater than 38 inches, you're at risk for having a cardiovascular event. And what I mean by that is having a heart attack, a stroke, or sudden cardiac death, none of which are good. Now, how do you measure your waist? People don't know how to measure their waist. You have a pelvis, and there are bones called the iliac crest. Basically, it's in line with your belly button or your umbilicus. So if you put the tape measure around the iliac crest and it comes up to the umbilicus, you'll be getting an accurate measurement of your waist. Now, the reason that this is so important, because there is a new syndrome which has been described within the last 10 years, and it's very prevalent in the United States, and it's very prevalent around the world. It's called metabolic syndrome. Now, what does that mean? Metabolic syndrome is defined as those people, whether it's a male or a female, who have excessive abdominal obesity or belly fat. And belly fat is an essential part of this syndrome. There are other things that are essential parts of the syndrome too, such as having a blood pressure that's high, or having being insulin resistant. That means the insulin in your body doesn't work properly, or having a high triglyceride level in your blood. I make a diagnosis very simply in my office. When patients walk into my examining room, if their belly walks in first, I know they have metabolic syndrome. I don't even have to take their blood pressure or take their blood sugar or measure their insulin resistance or measure their triglycerides. I know just by looking at them. Now, the interesting thing about that is that this body fat, this accumulation of fat cells in your belly, becomes a very toxic organ. It becomes an organ just like any other organ in your body, just like your heart or your kidney or your brain or your lungs. It just becomes an organ unto itself. And that organ produces some damaging and toxic hormones. These hormones are called cytokines in medical parlance. And there are about 20 cytokines that are produced by abdominal fat. And what they do is they destroy the body, especially the lining of all the blood vessels. The lining of the blood vessels is extremely important. That lining is called the endothelium, and that endothelium has to be intact for the body to maintain its health, because if it's attacked by these toxic hormones, plaques are going to form in the area of attack. And those plaques can lead to a heart attack, stroke, sudden cardiac death. So start to think about reducing your body fat. It behooves you to start exercising and reduce your intake of fatty foods and cholesterol. And if it's white, don't bite, like white rice, white bread, white pasta, white potatoes, because those are foods with high glycemic indices, and they lead to deposition of abdominal fat, which means that if you consume these foods, they will be converted to fat very quickly, and they will be deposited in your belly. So try to keep your belly fat down.